Tips for preventing heart disease. Heart disease is the leading cause of death in the United States, with over 600,000 people dying from it each year. While genetics can play a role, there are many lifestyle factors that contribute to the development of heart disease. Fortunately, there are also many steps you can take to prevent heart disease and keep your heart healthy. In this video we'll share some of the most effective tips for preventing heart disease, including dietary changes, exercise recommendations, and stress management techniques. By adopting these strategies, you can reduce your risk of heart disease and keep your heart healthy for years to come. So, whether you're at high risk for heart disease or simply looking to improve your overall health, read on to learn how to take care of your heart. On this YouTube channel we upload videos about health, self-care and self-development. Please like the video and subscribe the channel and press the bell icon to get notifications of our videos. 1. Introduction to the importance of keeping your heart healthy. Keeping your heart healthy is one of the most important things you can do for your overall health and well-being. Heart disease is one of the leading causes of death worldwide, and it can strike at any age. While some of the factors that contribute to heart disease are beyond our control, such as genetics and age, there are many things we can do to reduce our risk of developing heart disease or suffering a heart attack or stroke. The good news is that making small changes to our lifestyle can make a big difference in keeping our hearts healthy. Simple things like getting regular exercise, eating a healthy diet, and managing stress can all help to reduce our risk of heart disease. By making these changes and adopting healthy habits, we can take control of our heart health and improve our chances of living a long and healthy life. In this video we will explore some practical tips for preventing heart disease and maintaining a healthy heart. From understanding the risk factors for heart disease to making healthy lifestyle choices, we will provide you with the information and resources you need to take charge of your heart health and reduce your risk of developing heart disease. So, let's get started on the path to a healthy heart. 2. Understanding heart disease and its causes. Before we dive into prevention tips, it's crucial to understand heart disease and its causes. Heart disease is a term that refers to several different types of heart conditions. These conditions can range from coronary artery disease, heart rhythm problems, heart valve disease, to heart infections and congenital heart defects. Heart disease can affect anyone, but there are certain factors that increase the risk of developing it. These include high blood pressure, high cholesterol, smoking, obesity, diabetes, a family history of heart disease, an unhealthy diet, and lack of physical activity. High blood pressure, also known as hypertension, is a major risk factor for heart disease. This is because it puts extra strain on your heart and blood vessels, which can lead to damage over time. High cholesterol is another risk factor, as it can lead to plaque buildup in your arteries, making it harder for blood to flow through them. Smoking is also a major cause of heart disease, as it damages your blood vessels and makes it harder for your heart to pump blood effectively. Obesity, diabetes, and an unhealthy diet all contribute to the development of heart disease by increasing blood pressure, cholesterol levels, and inflammation in the body. By understanding the causes of heart disease, you can take steps to prevent it. This includes making lifestyle changes such as quitting smoking, eating a healthy diet, and getting regular exercise to maintain a healthy weight and lower blood pressure and cholesterol levels. It's also important to manage any underlying conditions such as diabetes or high blood pressure, as these can increase your risk of heart disease. 3. Key risk factors for heart disease. It's important to understand the key risk factors for heart disease in order to prevent it. The first major risk factor is high blood pressure, which puts a strain on your heart and can lead to heart disease if left untreated. It's important to have your blood pressure checked regularly and to follow your doctor's recommendations for managing it if it's high. The second major risk factor is high cholesterol, which can lead to the buildup of plaque in your arteries and increase your risk of heart disease. Eating a healthy diet low in saturated and trans fats, and getting regular exercise, can help keep your cholesterol levels in check. Other risk factors for heart disease include smoking, diabetes, obesity, and a family history of heart disease. Quitting smoking, managing your blood sugar if you have diabetes, maintaining a healthy weight, and talking to your doctor about any family history of heart disease are all important steps you can take to lower your risk. It's also important to note that women may experience different symptoms of heart disease than men, such as fatigue, shortness of breath, and nausea, which can be easily overlooked. Knowing the risk factors and symptoms of heart disease can help you take proactive steps to prevent it and maintain a healthy heart. 4. Tips for reducing risk factors, including maintaining a healthy weight, exercising regularly, and quitting smoking. Maintaining a healthy weight, exercising regularly, and quitting smoking are all important steps in reducing risk factors for heart disease. The good news is that making positive lifestyle changes in these areas can significantly improve heart health. First and foremost, maintaining a healthy weight is critical. Excess weight puts added strain on the heart and can increase the risk of heart disease. Adopting a balanced, nutrient-dense diet and engaging in regular physical activity can help individuals achieve and maintain a healthy weight. Additionally, regular exercise is key to promoting heart health. Exercise strengthens the heart and cardiovascular system, lowers blood pressure and cholesterol levels, and can help reduce stress. Experts recommend getting at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming. Finally, quitting smoking is one of the best things you can do for your heart health. Smoking damages the heart and blood vessels, leading to increased risk of heart disease and stroke. Quitting smoking can be challenging, but there are a variety of resources available to help individuals quit, from nicotine replacement therapies to support groups. Overall, taking steps to reduce risk factors for heart disease can have a significant impact on heart health. By maintaining a healthy weight, exercising regularly, and quitting smoking, individuals can improve their overall cardiovascular health and reduce their risk of heart disease. 5. The importance of a balanced and heart-healthy diet, including recommendations for specific foods to eat and avoid. Maintaining a balanced and heart-healthy diet is an important part of preventing heart disease. Your diet should be rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. These foods provide your body with essential vitamins, minerals, fiber, and nutrients that are necessary for optimal heart health. When it comes to specific foods, some of the best choices for a heart-healthy diet include salmon, nuts, berries, leafy greens, and whole grains. These foods are high in omega-3 fatty acids, antioxidants, and other nutrients that promote heart health. On the other hand, there are also foods that you should avoid or limit in your diet. These include foods high in saturated and trans fats, sodium, and added sugars. Some examples of these foods include fried foods, processed meats, sugary drinks, and high-fat dairy products. Making small changes to your diet can have a big impact on your heart health. Try swapping out unhealthy foods for healthier options, such as choosing whole grain bread instead of white bread or opting for a piece of fruit instead of a sugary snack. Additionally, it's important to pay attention to portion sizes and limit your intake of high-calorie foods. By making these changes and incorporating more heart-healthy foods into your diet, you can reduce your risk of heart disease and improve your overall health and well-being. 6. The role of stress in contributing to heart disease and ways to manage stress. Stress has become an unavoidable part of our daily lives. It can be caused by work, family, health concerns, or just everyday situations that we find ourselves in. However, studies have shown that chronic stress can have a significant impact on our heart health and contribute to the development of heart disease. When we are stressed, our bodies release hormones like adrenaline and cortisol, which can increase our heart rate, blood pressure, and even affect our cholesterol levels. Over time, this can lead to inflammation and damage to the blood vessels in our heart, which can increase the risk of heart disease. Fortunately, there are many ways to manage stress and reduce its impact on our heart health. Some effective stress management techniques include practicing mindfulness meditation, yoga, or deep breathing exercises. Engaging in physical activity like walking, running, or swimming can also help to reduce stress levels and improve overall heart health. In addition, it's important to maintain a healthy work-life balance and make time for activities that you enjoy. This can help to reduce stress levels and promote overall well-being. If you feel overwhelmed, don't hesitate to seek support from friends, family, or a mental health professional. By managing stress effectively, you can reduce your risk of heart disease and promote a healthier, happier life. 7. The importance of regular physical exams and screenings for heart disease. Regular physical exams and screenings are essential for good heart health. When it comes to heart disease, early detection is key to preventing serious complications down the line. That's why it's important to schedule regular checkups with your doctor, especially if you have a family history of heart disease or other risk factors such as high blood pressure, high cholesterol, or diabetes. During these visits, your doctor will check your vital signs, listen to your heart, and ask about any symptoms or concerns you may have. They may also recommend certain tests to assess your heart health, such as an electrocardiogram, ECG, or stress test. In addition to seeing your doctor regularly, it's important to be aware of any warning signs of heart disease. These can include chest pain or discomfort, shortness of breath, fatigue, and swelling in the ankles or feet. If you experience any of these symptoms or have concerns about your heart health, don't hesitate to speak with your doctor right away. By staying on top of your overall health and taking steps to prevent heart disease, you can help ensure a healthier, happier life for yourself and your loved ones. 8. Possible preventive measures, including medication, surgery, and lifestyle changes. When it comes to preventing heart disease, there are a variety of possible preventive measures that can be taken. These measures can range from medication and surgery to lifestyle changes. Medication can be an effective way to prevent heart disease, especially for those who are at high risk. Medications may include those that lower blood pressure or cholesterol, or even aspirin therapy. Your doctor will be able to determine what medications are right for you based on your individual health needs. Surgery may also be an option for those with severe heart disease, such as coronary artery bypass surgery or angioplasty. These procedures can help improve blood flow to the heart and reduce the risk of heart attack. However, lifestyle changes are often the most effective and sustainable way to prevent heart disease. These changes may include quitting smoking, maintaining a healthy weight, exercising regularly, and reducing stress levels. Eating a heart-healthy diet that is low in saturated and trans fats, and high in fruits, vegetables, and whole grains, can also greatly reduce the risk of heart disease. It's important to note that preventive measures should be taken before heart disease sets in. By making these changes early, you can greatly reduce your risk of developing heart disease and improve your overall heart health. 9. Ways to stay motivated and accountable in your heart health journey. Staying motivated and accountable in your heart health journey can be challenging, but it's important to keep yourself on track in order to prevent heart disease. Here are some ways to stay motivated and accountable. 1. Find a support system. Having a support system can make a huge difference in staying motivated. Join a heart health support group, work with a personal trainer, or find a workout buddy to keep you accountable. 2. Set achievable goals. Setting achievable goals can keep you motivated as you work towards your heart health goals. Start with small goals, like walking for 30 minutes a day, and gradually work your way up. 3. Track your progress. Tracking your progress is important to stay accountable. Use a fitness tracker or app to track your workouts, or keep a journal of your progress. 4. Celebrate your successes. Celebrating your successes, no matter how small, can keep you motivated. Treat yourself to a healthy meal or a relaxing massage after reaching a milestone. 5. Stay positive. Staying positive is key to staying motivated. Don't beat yourself up if you have a setback, just focus on getting back on track and moving forward. By implementing these tips, you can stay motivated and accountable in your heart health journey and prevent heart disease. Remember, taking care of your heart is a lifelong journey, but it's worth it for a healthy and happy life. 10. Conclusion and encouragement to take action towards a healthy heart. In conclusion, taking care of our heart health is crucial to living a healthy and fulfilling life. With heart disease being a leading cause of death worldwide, it is important to take preventative measures and make positive lifestyle changes to reduce our risk. By implementing the tips and advice outlined in this article, we can start taking steps towards a healthier heart. Eating a balanced diet, staying active, reducing stress, quitting smoking, and getting regular checkups are just a few examples of simple yet effective ways that we can prioritize our heart health. Remember, it's never too early or too late to start taking care of your heart. Making small changes to our daily habits now can have a significant impact on our heart health in the long run. Let's all make a commitment to ourselves and our loved ones to prioritize our heart health and take action towards preventing heart disease. With dedication and effort, we can all work towards living a healthier and happier life. We hope you enjoyed our video on tips for preventing heart disease. Heart disease is a serious condition that affects many people, and it's important to take steps to prevent it. By following the tips provided in this article, you can maintain a healthy heart and reduce your risk of developing heart disease. Remember, prevention is always better than cure, so start taking care of your heart today. Thank you for reading, and we wish you a long and healthy life. Please like the video and subscribe the channel.